Hey, thank you so much for joining us here today. My name is Julie Challoner. I am the Associate Director. I actually work with applicants who are interested in our accelerated programs. We're going to go over some information today regarding the accelerated program that is offered at our Worcester and Manchester campuses. And then also our Boston campus does offer a non-accelerated program as well. So we'll cover some information about that. At the end of the presentation, I will have some contact information. This will include contacts for my colleagues who are unable to make it today, but they will have information on how you can contact somebody for both the Boston and the Manchester campuses, as I do work with Worcester individuals. I am joined by one of our current students today. She's going to give some information about what it's like to be a student here and kind of what she's experienced since she's been at MCPHS. So I'll just turn it over to her to introduce herself for a moment.
Hi everyone, my name is Hani. I'm currently a second year student at Worcester campus. Originally, I'm from India, so I'm an international student. But yeah, I'm about to finish my academic years and go into my final year rotations.
Great. So just to get started, we like to show some statistics regarding pharmacy and kind of pharmacy in general. As you're thinking about a pharmacy career or really a career in healthcare, students are putting time and money into these careers. You're kind of putting your professional life on hold for a bit as you pursue this graduate level education. And you're not necessarily earning the same amount of money you would make if you were currently working full time. And our students want to make sure that they are getting return on the investment. Whether you attend a 4-year program like our Boston program or a 3-year program like Worcester and Manchester, again, it is kind of a time commitment there. So we do like to show that there is a return on that investment. According to the U.S. Bureau of Labor Statistics, the median annual wage of a pharmacist is about $132,000. Just keep in mind that that's the median for the entire United States. It's obviously going to vary depending on where you live. If you live in a higher cost of living area, somewhere like California or the Northeast here where I am currently located, you're probably going to see salaries a little bit higher than that just to offset the cost of living. Same thing if you happen to live in an area that maybe is a little lower cost of living, maybe down south or somewhere that's more rural and it doesn't cost as much to live there. You may see a salary slightly below that number, but it is an average there. I do like to talk to current graduates from our program to get a feel for what are they seeing. Of course, we can provide you with statistics, but what are our students actually seeing once they graduate and go out into the workforce? And I was able to talk to a few students this past spring, and they let me know they did all have jobs lined up before graduation, the 4 students that I spoke with, and they let me know they were seeing salaries somewhere between $130 and $140. So again, it is pretty much on par with what is listed here. We are rated number 3 on return on investment. So again, you're putting time and money into your education, whether you are financing that education yourself through self-pay or some type of federal financial aid. We want to make sure that our students do understand that they are getting a return on that investment once they graduate. Particularly if you're choosing to use any type of federal loans, you want to make sure that once you do graduate from our program, you are able to get a job and then you are ultimately able to pay back that investment. And you should feel confident that if you were to attend our university that you would definitely get that return there. In general, healthcare is a really great field to go into. It's continuously to grow. I think there was a spotlight placed on healthcare during the pandemic and really highlighted how much we need healthcare workers. I think a lot of people also returned to healthcare institutions. Prior to the pandemic, a lot of people may have been getting their medication through the mail. They may not have been going into their actual pharmacy, but there's definitely been a rise in people returning to pharmacies to ask questions, to pick up their prescriptions and things like that. So I definitely think it is a great field to go into. There is a lot of growth. Pharmacy is changing a lot. You don't just necessarily have your community pharmacy anymore and your institutional, those were kind of your 2 tracks, whether you went into a hospital setting or again worked in the community setting, which is more like your CVS and your Walgreens. Now people are working in specialty pharmacies that may focus on making oncology drugs or nuclear pharmacy. There's also been a big spotlight on industry. So drug development, vaccine development, things of that nature. Here in Massachusetts, we are number 1 in the country for biopharmaceutical investments. So that's definitely something that is very prevalent here. So again, there's so many different avenues that pharmacists can take. The things that they can do is constantly expanding. And you will continue to see that as you head through your education. So some things about MCP. We have over 100 programs spread throughout our 3 campuses, and they all focus on healthcare. So that means that everything that we do here focuses on something healthcare or life sciences. So, of course, we have clinical programs like pharmacy, which are the programs that you guys today are thinking about. We have other clinical programs like optometry and physical therapy. But then we also have programs that focus on maybe a research perspective, like clinical research. And we have programs that focus on health sciences, health psychology, healthcare administration, and things of that nature. So regardless of what kind of degree our students are looking to get, whether that's a bachelor's degree, master's, or doctoral level, they're all focusing on healthcare. So that's something that's unique, and all of your peers are studying the same things as you, which you may not have seen if you have an undergrad degree or if you've been to other colleges. We are the oldest university in Boston. We were founded in 1823. So we recently, last year, celebrated our bicentennial. We had a big celebration for that. So you can be confident in the school that we are here. We've been around for a long time, and we are actually the second oldest pharmacy program in the country. We do enroll about 7,000 students from all over the US. So we have students that come, as I mentioned previously, from California, Texas, Florida, all the way up to the Northeast. And we have a fair amount of international students. As Henny herself mentioned, she is originally from India. We have a fair amount of Canadian students. So you definitely get students who are from all over and can experience kind of interacting with different cultures and things of that nature. So one of the big things here is interprofessional education. So as I mentioned previously, all of our programs do focus on health sciences. So again, everybody is studying the same disciplines. They may not be studying the same programs. Of course, we have a physical therapy program. They're going to be learning about what it's like to be a physical therapist, and their courses are going to focus on that aspect. Whereas a pharmacist, obviously your courses are going to focus more on pharmacologies and drug development and things of that nature. But both of those careers work together in the healthcare field. And when you get out into the healthcare field, you are not going to work in a silo. You are going to work with other health professionals, whether that is other pharmacists, pharmacy technicians. You, of course, are going to interact with doctors, nurse practitioners, physician's assistants, insurance companies, all of these different individuals in a day-to-day basis. Nobody kind of works by themselves. And because we all focus on the health sciences here, we're able to parallel the real team-based worlds of healthcare in a simulated environment. So we're able to give you exposure to these different healthcare professions prior to getting out into the field. So once you are actually out in the field, whether that's on clinical rotations or actually working as a pharmacist, you've already been exposed to these different disciplines. Many of my current students actually say that IP is one of their favorite aspects of our campus. They really enjoy interacting with their peers and really learning from their peers, particularly if they're not that familiar with a particular program that you offer. For example, we offer an acupuncture program, and not everyone is familiar exactly what an acupuncturist does. So it's a really great way to kind of learn more about that profession while they're here. So I'm going to turn it over to Henny. As she mentioned previously, she's actually finishing up her second year here. So she's definitely had some IP experiences throughout her first 2 years, and kind of let her talk about that.
Sure. So, as Julie mentioned, it's like different professions comes together and we discuss patient cases and we talk about each other's professions. So, how this activities works is like we come together on a topic and then topic has been given to you for a long time. So you study on your own and then come together, discuss different patient cases and give your opinion. So, from pharmacy perspective, we discuss about our opinions and our regimens and everything. Acupuncture, they talk about their perspectives. Nursing, they talk about their roles and responsibility. So we have PT, OT, dental hygienist, sonographer. Everyone just come together. Recently, we had it like 2 days ago. We had it naloxone opioid overuse training. So in that case, we talked about how to avoid opioid overuse in patients. So how we can help patients with different approaches. So we talked about from pharmacy perspective, like how we can counsel patients when they come to get their opioid prescriptions. And acupuncture, they talk about how they can help patients in their professions. PT and OT, they talk about like how physical therapy and other pain management strategies can be used. So through these activities, we basically learn to respect each other's professions and mainly a communication skills and how to collaborate with each other and work together for a good patient outcome.
Great, thank you so much. So yeah, so that just gives you a basic idea. The other thing that our students get to do together that's not necessarily a formalized event like an IP event, but we also have many student organizations on campus. We'll get to that in a minute, but many times they also partner together. They're not necessarily all programmatic based, and so you can interact with your peers that way as well. So some of the things that we offer here on campus, everybody on our campus has access to a variety of facilities, and this is regardless of the campus that you attend. So again, we do have 3 physical campuses, but all of these, regardless of the program of the campus that you attend, you are going to have access to all of these different kind of facilities and programmatic structure pieces. So for one, everybody has access to pharmacy clubs and organizations, as I just mentioned. So again, we have campus-wide organizations, and then we have pharmacy-specific ones. These are going to vary from like a national organization all the way down to more niche organizations. So if you're somebody who's interested in pediatrics or you're interested in industry pharmacy, there is probably an organization for you here that focuses on that particular issue. But then also if you're just more interested in learning or participating in a national pharmacy organization on campus. It doesn't necessarily focus on a certain specialty of pharmacy. We have that as well. Of course, when you're in our program, ultimately you want to graduate from a pharmacy program and pass your board so you can become licensed pharmacists. So throughout our curriculum, we do have NAPLEX preparation. This is especially true in the 3rd year of the program, if you're in the accelerated program, or again, the 4th year of the program, if you're in Boston. But we are going to constantly be talking about NAPLEX preparation. How do you prepare for the boards? How are the boards administered? What can you expect when you go through that? So you feel prepared when you actually do sit for your boards once you do graduate. Our students do go on to postgraduate opportunities. So we do have a mix of students who just graduate from our program and want to get a job right away. They may be heading into a community pharmacy or some other branch of pharmacy right out of the gate. But we also have a fair amount of students who pursue advanced education. So this would be in the form of residencies or fellowships. So we definitely have a mix of opportunities for our students, depending on what you're most interested in. We do offer a variety of graduate certificates. You can see a whole host there. That is not an exhaustive list. We do have a couple other ones that are not listed. But again, you do have access to all these different options when you're in our program and can kind of pick and choose what would work best for you. Of course, there is a set curriculum that everyone needs to study, but we do like to offer these graduate certificates that you can take during an elective period to kind of enhance the education that you're already receiving. Our students also have access to research opportunities, so they can work with members of faculty on research. And there is, in certain instances, a dual degree available. So I'm going to turn it over to Henny. I know she's participated in some clubs and organizations, and I think she also may have done research while she's been here on campus. So I'll kind of let her speak to those.
Yeah, so we have many organizations on campus, including specialty organizations. So, like for example, industry pharmacy organizations, or community pharmacy organization, or clinical pharmacy organizations, or American Pharmacy Association of Pharmacy, which is the biggest organization on campus. So, main thing about this organization, like anyone can join in from their first year and kind of join all the organization, attend the events organized by these organizations. So all they do is like invite guest speakers who are already working in their professions. They come as a guest speaker and kind of talk about their experiences in the field and what they did to reach to that position. So it kind of gives us an idea like what different career opportunities are out there for us while you are in the school. So I basically joined almost I try to go all the events so I can know like what I really enjoy. So through joining this organization, I kind of narrowed down my options, and I realized that I enjoy industry most. And then I got some leadership positions in the industry pharmacy organization, which I was running as a president for a year, and that also gave me some leadership skills. And I also got to organize some events by myself. and then joining a national meetings and everything. So I think that was a great opportunity. And you also get to go to the conferences and present your own research if you are doing any kind of research with any professors. MCP here, we they do offer many research opportunities under different professors. So even if you're not doing any graduate certificate or concentration with professor, but you are certainly interested in any certain area of pharmacy, like you can reach out to the professor and they definitely help you guide throughout your 3 years. Right now, currently, I'm working with Dr. Campbell here on our campus for cancer research. So we work on glycosylation of the drug delivery in cancer cells. So that's quite a good, it's a part of the concentration graduate certificate program. But so all in all, I want to say is that like university does offers different research opportunities, whether you are enrolled in graduate certificate or not, and you want to do individually your own thing.
So I mentioned previously, we do have 3 campuses. We have our Boston, Massachusetts campus, which was founded in 1823. I would say that campus has a mix of undergrad and graduate students. We definitely have students who come straight out of high school and pursue a bachelor's level degree. And then we have a mix of master's and doctoral students pursuing both clinical degrees like pharmacy, as well as more research-based degrees like clinical research or pharmaceutical economics. We have our Worcester campus, which was founded in 2000. We have about 1,600 students. For those who are maybe not familiar with Massachusetts geography, Worcester is about an hour west of Boston. Unlike Boston, we don't have too many undergrad students. For the most part, our programs are more graduate level based. And same thing with Manchester. Manchester was founded in 2002 and is about an hour north of Boston. So again, all of our campuses are essentially located to a major city or a major hub. Both Worcester and Manchester are cities as well as Boston, just on the smaller side. So we offer 2 programs. We offer our direct entry program in Boston. This is the 4-year program. So this is what you would consider a traditional pharmacy program that has a fall and a spring semester. In terms of this program, you do need to have the completed prereqs in order to enter directly into the 4-year program. You can find the list of prereqs on our website. However, if you're somebody who is maybe coming right out of high school or has only done like a semester of college, you could enter Boston. It's called pre-professional entry. This is where you would come in and complete the required prerequisites for the 4-year program. And upon successful completion of those prereqs, you would be able to move into the 4-year program. So if that's something that applies to you, you can certainly get in touch with my colleague, Ryan Dana, afterwards, and he'd be happy to talk about what that path looks like for you. But if you're somebody who's already completed a bachelor's degree or already completed all the prereqs, you can apply directly to the 4-year program. They do also offer an honors program available in Boston as well. We do offer the accelerated program on the Worcester and Manchester campuses. The accelerated program is the exact same on both campuses. So we have the exact same curriculum. We actually have 1 dean, 1 set of faculty, and 1 accreditation. The only difference between the 2 programs is physical location. So there's no difference in terms of admissions criteria or kind of how the programs are structured. They're exactly the same. Our students actually follow the same exact schedule and everything there. Again, the only difference is physical location. So if you are thinking about the accelerated program, you kind of want to think about which location would you like to be in. Would you like to be in a larger city with a larger cohort in Worcester, or are you thinking more of like a smaller city with a smaller group of students in Manchester? And that would be, kind of where you would apply. This program is 2 years didactic and 10 months of advanced rotations. So basically you are 2 years on campus doing classroom-based learning. That's kind of what Henny has just been doing the last 2 years. She's been here for the most part on campus doing classroom-based learning. And now she's getting ready at the end of the summer to go off and do her advanced rotations outside of our campus environment. Unlike the Boston program, you do need to have the required prerequisites to enter our program here. You can't come in and do those basic courses. So if you're missing things like organic chemistry or basic biology, you would need to take those courses prior to enrolling in the accelerated program, as when you come here, we're only offering the pharmacy coursework. The one thing I do like to highlight is regardless of the program that you're applying for, if you are thinking about applying, please make sure you only apply to 1 campus. PharmCast itself will physically let you apply to all three campuses, and of course charge you a fee for that. But we will actually only consider you for one campus at a time, particularly in the Worcester and Manchester case. Again, there's no difference between admissions criteria between those two campuses, so there's really no reason to apply to both campuses. Again, FarmCast will take your money, and unfortunately, since the money does go to FarmCast and not us in terms of an application fee, we're not able to refund you that fee. So again, just keep in mind, it's best to only apply to the campus that you are most interested in. So in terms of clinical rotations, again, for both Boston and the accelerated program, we do have a mix of clinical rotations. So you do two rotations during the beginning of the program, one in community and one institutional. And then towards the end of your program, you do your advanced rotations or your APPEs. And those are the ones that Henny is getting ready to go out on. As you can see, there's a whole list there. Everybody is guaranteed rotation sites. You do not have to go out and find your own rotation sites. Typically, if you attend the Boston program, a lot of your rotation sites will be in the greater Boston area or in the city itself. For those who attend Worcester or Manchester, typically we offer rotation sites right around Worcester and Manchester to make it convenient for students. However, if you are a student who's from further afield, maybe you're not from the New England area, you can certainly go into rotations outside New England. That is not a problem. You can certainly list those out when you're picking kind of your sites and say that you're interested in going, to California or New York or something like that. So there is a mix available for students. But if you are somebody local to New England, or if you're specifically local to Worcester or Manchester or Boston, you can be assured that there will be a site for you close by to where you currently are located. So I am going to turn over to Henny. As I mentioned previously, she has already done her IPPEs, so she can kind of talk a little bit about that. And she does have her sites for APPEs, so maybe she can talk about the APPE rotation that she is most looking forward to.
So for my introductory rotations, each rotation is for 4 weeks. So I did 4 weeks in community pharmacy, which is I did in CVS, and institutional I did in UMass Hospital here. So for my community, I did get an opportunity to work under my preceptor and got to do different activities related to pharmacy and got to know different pharmacy facets. Like, I got to do patient counseling, medication management, and then like prescription verification and how to use their community software. So I used to do daily activities, but under the supervision of my preceptor. So as you are not licensed yet with the pharmacy. And also it was a great opportunity for me to ask many questions and learn whatever I learned in classroom to apply in the real world scenarios. You are also supposed to finish the workbook here. Workbook consists of many questions, so those also lead you to different experience in the pharmacy out there. So if you're not aware about any kind of question, you kind of talk with your preceptor and try to gain that experience as well. I also got to apply my pharmacy law because we study pharmacy law in our first semester. So once you go out there for even introductory rotations, you are all set for your laws part of the pharmacy. So you also get to experience the different pharmacy law scenarios in the pharmacy as well. And for my institutional pharmacy, I had an amazing experience at the UMass Hospital, as I used to go in the rounds with my preceptor. So in the round, I got to experience the interprofessional education that I learned here as well, because I got to interact with nurses, doctors, and also got to interview patient as well by myself. I did patient interview for different allergy questions. So through this experience, like whatever I learned in classroom, and before you go on rotation, school also prepares you for your rotations. They make sure that you are up to date with different experiences that you are going to experience outside. And so those were the introductory, but now for the advanced rotations, you are doing total of 6 rotations in different, like for example, internal medicine, institutional, pharmacy, ambulatory, community, and another 2 elective rotations. One of my elective rotations I'm doing with my research that I already have been doing. So I'm continuing that rotation as one of my elective. Other elective I'm doing because I'm interested in industry rotation. So I'm doing it the Biogen for medical affairs. For elective, you get a lot of different options. So according to your own interest in pharmacy, if you're interested in hospital or business side of the pharmacy, they also have different options for that as well. So you kind of get to choose what you want. And for other rotations, also they have many different size. You pick your top 10 choices, and then out of those top 10, you get they pick randomly pick one site for you. So all in all, a lot of my rotations are with my own professors at school here as well, because our professors also practice outside in different clinics and pharmacies. So you also get to do rotations with them as well.
How do you apply? Application is through FarmCast only. Again, this is for the professional entry. So if you're applying directly to the 4-year program or you're applying to the accelerated program, if you're somebody, as we talked about previously, that needs to do prereqs and would need to come to this to our Boston campus to do those, there is a separate application for that on our website that we can get you the information for. But for those looking to do professional entry, you would apply through FarmCast. FarmCast does require that you send transcripts from all schools attended. So even if you took one summer class from a community college or you took an online class from somewhere, you do need to send that transcript to FarmCast, even if it transferred into your undergrad institution, as FarmCast does require that. If you are an international applicant who has international coursework, we do require a transcript evaluation. Ideally, we would prefer West, but we also accept ECE. Just make sure that you do get a course-by-course evaluation. Both of those transcript evaluators will just offer you a degree transcript, but we do need a course-by-course in order to consider you. We do require one letter of recommendation. This could be from anyone you would like. Typically, students will get one either from a current pharmacist if they work as a pharm tech, or if they work in the medical field, someone that they work with, and then a professional reference from their school. Particularly if they're still in a school, they'll ask an advisor or professor to write one for them. We also require a personal statement be submitted to FarmCast. You can find the prompt on there. And then if English is not your native language and you didn't do your bachelor's degree in English, we would require proof of English proficiency. Again, if you fall into that bucket, you can certainly reach out to us and we can provide more information on the tests that we do accept. And then we do not require any type of standardized test for our program. So if you are thinking about fall, I know fall is fast approaching, but the final deadline is June 30th, which is next week, or is a week from this weekend. So definitely make sure that you do get your application in as soon as possible. You would need to request an extension code, so you would need to get in touch with us so we can provide you with an extension code, but that deadline is June 30th. For those who are thinking fall of 2025, the new FarmCast application will open July 11th, 2024. Please do not apply before July 11th, as you will be using the fall 2024 FarmCast application. And unfortunately, once FarmCast closes on the 30th, they will wipe those applications from the system. So you personally will not be able to go in and view your information, and you will get stuck restarting the whole application. There is some parts that can be tedious in terms of entering your grades and your transcripts. So you definitely only want to have to do that once. So definitely wait until the 11th. The deadline for fall of 2025 will be June 3rd, 2025. Things that we look for in terms of competitive applicants, we're going to look at your overall GPA, your overall science GPA, as well as those prerequisite courses that we require. Please keep in mind that we do use FarmCast GPAs. So FarmCast is going to calculate every course that you've ever taken. So even if you took a course and then repeated the course for a better grade, FarmCast is still going to calculate both of those grades into both their cumulative and science GPAs. So just keep that in mind. We also are going to kind of look at, where'd you go to school? How long ago were you in school? Kind of how are your trends in school? So it's not just the GPAs that we focus on. We focus on the whole academic picture. We also are going to look at your experiences. So are you working as a pharmacy technician? Are you working in the medical field? What are you doing? And even if you are not working in the medical field or a pharm tech, neither of those are required. Definitely make sure you list off any experiences that you have. This could be clubs and organizations that you joined in college, especially if you had a leadership position. This could also be other jobs, even if you worked part-time or even full-time while you were an undergrad, but it wasn't in the medical fields. Definitely list that, because that tells us more about your story. If we can see that you're taking classes full-time, but also working full-time, that's going to give us more information about, what kind of student you are, how you balance your time management, things of that nature. We also look at your interest in attending pharmacy school. So this is where that personal statement will come into play. This is where, we're going to kind of see what are your motivations for going to graduate school. Same thing with your letters of recommendation. We will also look at any letters of recommendation that have been submitted, kind of what they have to say. And then finally, there is an interview component. Interviews are by invitation only for all 3 campuses, and they are with a faculty member. Typically, we do virtual interviews. We have had some on-campus interviews throughout the year, but for the most part, we do offer them virtually through Zoom, just to make it easier for students to attend. There's usually more flexibility with that. There is also a writing sample. Again, if you are invited for an interview, you will get all the information you need at that time in terms of what to expect from both the interview as well as the writing sample itself. In terms of prerequisites, you can find our list online. Definitely make sure to check out the list for both the Boston and the accelerated programs, as they do vary slightly. They're not exactly the same, but we do require a C or higher regardless of the program you're applying to. Courses can be missing or in progress, particularly since we're coming up on the fall 2025 application. If you're going to be finishing up your senior year of college, you probably, obviously you don't have your degree yet, and you may be missing some courses that you plan to take fall of 24 and spring of 25. That's not a problem. You can apply with those courses missing. If you are admitted to the program, the expectation is you would complete those courses with the required grade prior to attending our program next fall. PharmCast does let you list out planned courses or in progress courses. So if you know what you're taking, that's really helpful. Of course, like, don't worry if something changes. If you list out that you're planning to take organic chemistry 2 in the spring of 2025 and you end up not taking it because you're planning to take it in the summer or something like that, that's fine. It's okay if they change, but at least it gives us an idea of when you plan to complete any outstanding coursework prior to attending our program. We do accept CLEP and AP options, and then we do have a 10-year limit on math and science courses. So that's 10 years from the date of matriculation. So for fall of 2025, that would be any courses taken before the fall of 2015. However, if that 10-year limit does apply to you, I still recommend that you reach out to us, as we do evaluate those situations on a case-by-case basis. So we always recommend that students reach out to us, and we can advise you on kind of what's the best path for you forward. In terms of financial aid, we do offer Merit Scholarship Awards. Everybody is considered for our Merit Scholarship Awards when they apply. They do vary. Again, I'm not sure what they'll be for fall of 25. We usually typically start to hear information as we head into the fall. But the time you apply to the program and were to get an acceptance letter, you would know what the Merit Scholarship Awards are. But again, everyone is considered for them. You do not need to do anything on your end. You will automatically be considered. Of course, applying early is always for the best, as you can receive priority review for those awards. If you are a domestic student, you are welcome to fill out a FAFSA. You can find our code online. Please note there is only one code for all 3 campuses. Just fill it in and it will make it to us. But you definitely can apply for FAFSA. And then we do have a student financial services office on all 3 campuses that works with our students on any type of financial questions that they may have. Finally, some contact information here. So you have my contact information as the Worcester contact. Courtney Bibbo is the contact for our Manchester applicants, and then Ryan Dana is the contact for the Boston applicants. We do also offer campus tours and events at all 3 of our campuses. So if you go to the Visit Us page, you'll be able to view them there and sign up for anything that you may be interested in. Before I end today, I wanted to turn it over to our audience, see if they had any questions. There is a button that you can type in any questions that you may have. So definitely feel free. There's a Q&A button to type in a question, and we'll be happy to answer them live here for you. I would just say, while I give you a minute to think, if you have any questions, I'm just going to ask Henny what's one piece of advice she would give to prospective pharmacy students who are thinking about attending a program.
I think from my side, from my experience specifically, it's a 3-year program, so it's definitely a little overwhelming. It's not something impossible. But if you know you are really interested in pharmacy and you are joining it, I think studying every day, because it's different than the undergraduate program. It's because now it's a professional program, so it requires a lot more attention than you had it in undergraduate degree. So I think being more organized and prioritizing your work and having a good time management skill is very important. I think if you don't know what kind of study method works for you, I think before starting a school or in your first semester, it's a great time to just explore all those options for you. And also try to explore once you start a school also like try to explore all the options for you. You may be thinking that it's not for you, but after maybe experiencing or attending an events or going on rotation, you might like something else than you thought.
So one of the questions was, if do we have any pharmacy research opportunities or interest in biopharma companies? So yeah, so we have faculty members on campus who do research already. They are actively involved in a variety of research. Students have a couple options. Sometimes you can just reach out to the faculty member themselves and say, hey, I really am interested in the research that you're currently conducting. Are you currently taking on any students to help you with that research? And they'll reach out to you and kind of schedule a meeting and kind of go from there. Other times, students use elective periods that are built into their schedule to do research with faculty members as well. We do focus a lot on geriatrics as well as cancer research. In terms of doing a rotation at biopharmaceutical companies, that's definitely an option. As long, industry is definitely available. Typically, there's an application process for those rotations. It's not necessarily something that you can just rank on your lottery and hope to get there. Typically, you do need to apply, but we have sent students to those sites before, and we do have experiential ed coordinators who kind of go over all the rotations with you, kind of go over how everything works, and they would help you through the application process there. Let's see. Great. So it looks like that's all the questions that we have for today. Thank you so much for joining us here. Again, the contact information is on this page. If you do have any questions for us, definitely feel free to reach out and we'll be happy to assist you. But I hope everyone has a great night.